You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Randy Menser. Mr. Menser is the owner of Randy's Compounding Pharmacy and Nutrition Center. He is a compounding specialist, menopause educator, and is a board-certified clinical nutritionist. He is here today to discuss bioidentical hormone replacement therapy. Mr. Menser, welcome to the program.
It's a pleasure to be here. You can call me Randy.
Okay. To begin with, let's talk about your center before we get into today's topic. Not your typical, is that fair to say, not a typical
It's not
pharmacy?
typical. That's correct. It's not exactly a typical pharmacy. We are a natural pharmacy, and we customize medication and nutrition to fit the needs of the individual patient. We have all kinds of high-tech equipment, molds, devices. We have the best chemicals and nutritionals that we can possibly get to make all kinds of different things, including troches and solutions and mouthwashes and so on and so forth.
Now tell me about this. First off, what is a compounding pharmacist? I mean, what defines it?
Well, I am a pharmacist. I am registered to practice in the state of Washington. I have postgraduate experience with compounding. We've gone to school, we go to classes, we've gone to a number of seminars throughout the years, and I have an extensive...
So you're making the medications?
We're making them. We're taking powders, and we're making prescriptions.
So now you're a clinical nutritionist.
Several years ago, I decided to take a postgraduate course in clinical nutrition. It was a very intense course. It took me about a year. I had to take a test to be certified, so I became a board-certified clinical nutritionist.
How are you using that in your pharmacy? And is that your role as a pharmacist, to get involved in that part?
It is absolutely my role as a pharmacist, and I can give you a good example. I had a lady who came in to me a while back, and she had a prescription for Prozac. And she brought it over to me, and she said, I've been depressed, and the last 6 months it's gotten much worse. So I went to my doctor, and he wrote me a prescription for Prozac.
Okay.
And I'm afraid to take this. Isn't there something that you have that's natural that I could take in place of Prozac?
Right.
And I asked her, well, what kind of medications are you taking? And she said, I'm not taking any medications. I said, well, are you taking any birth control pills? And she says, well, I'm taking birth control pills. I said, okay, well, maybe that's the problem. Why don't you sit down and let me go over something with you. Has anybody...
So she was taking birth control and Prozac?
Well, she was prescribed Prozac. She did not fill the prescription.
She didn't want to take it?
Yeah, she didn't want to take it. She did not have it filled. She brought me the prescription.
Got it, okay.
Okay, and basically, she was taking birth control pills, but she was not taking Prozac, and she was not taking any other medications.
Okay.
Okay, so I said, has anybody ever told you that when you're taking birth control pills, you should be taking vitamin B6? And she says, no. I said, you mean that no licensed healthcare provider, including a pharmacist, ever told you that you might start taking vitamin B6 with your birth control pills? She said, no. I said, sit down, let's go over something. I think I have something to share with you.
So as a pharmacist, you leave the counter.
Yes.
And in your pharmacy, you sit down somewhere?
I sit down at a consultation table.
Interesting.
And so she's sitting there, and I'm sitting here. So I showed her this pathway. In your brain, your body takes an amino acid called phenylalanine and converts that to another amino acid called L-tyrosine.
Okay.
And that's converted to another amino acid called tryptophan. That's converted to another amino acid called 5-hydroxytryptophan. And that is converted to a hormone called serotonin. Now, serotonin levels are directly related to depression. If your serotonin levels are low, there's two ways that you can increase your serotonin levels. You can take something like Prozac, which blocks serotonin from being taken away.
Okay.
Or you can make more. Those are the two choices. It seems logical to me that you would want to make more serotonin.
You can do that.
You can do that. You can do that.
Naturally?
Naturally.
Now you're back to the birth control situation.
Okay.
Are you saying that what? What's birth control's role here?
The role, it's not the role of the birth control pill that has on that. It is what happens with the birth control pills is that it sucks out vitamin B6. Vitamin B6 is necessary for every single amino acid reaction in the body. It directs traffic. It's a cofactor. It tells phenylalanine that we're going to make tyrosine out of you. It tells tyrosine we're going to make tryptophan out of you. It tells tryptophan, we're going to make 5-hydroxytryptophan out of you, and we're going to take 5-hydroxytryptophan and we're going to make serotonin. That's the role of B6. What happens with birth control pills? It sucks out B6. And this lady is sitting here thinking, wow.
Okay.
So I'm not going to tell her that she should stop taking her birth control pills. But what I will say is, I think we can take care of this with a therapeutic dose of vitamin B6. So we gave her a therapeutic dose of vitamin B6, and she left. A month later, she comes back to me, and she says, Randy, thank you. I never had to get that Prozac prescription filled. I feel great.
Now, moving on to today's topic, bioidentical hormone replacement therapy. We've had a lot of physicians on the program talking about this, a lot of confusion about it, a lot of negativity in the press about it. So I wanted to get the pharmacist's perspective. You're filling these prescriptions. So let's start with bioidentical hormones. And what is a bioidentical hormone? Who's a candidate? On your business card, it says you're a menopause educator. So let's talk a little bit about that.
We put classes on bioidentical hormones. Our classes are 4 hours long. We cover a lot of topics on that.
You lead them?
Yes.
Okay.
Always do. And the difference between a bioidentical hormone and a synthetic hormone are vast. In fact, you can take a synthetic hormone and say it's not really a hormone at all, it's a drug.
Okay.
So the bioidentical hormone, we could say if we had progesterone, for example, we have progesterone receptors. We have natural bioidentical progesterone that sits on those receptors just perfectly, just the way God intended that.
Okay.
We have estradiol that sits on estradiol receptors perfectly. We have testosterone that sits on testosterone receptors. We have DHEA that sits on DHEA.
So bioidentical hormones.
That means they sit on those receptors perfectly.
Okay.
Synthetic hormones do not fit those receptors.
Well, tens of millions of men, anticipating this interview, tens of millions of women are on, like for example, Premarin. And it does relieve symptoms. It seems to work. Are you saying that you could get the same results with a bioidentical alternative?
I'm saying that we can get the same results with no side effects.
Okay.
Our job, our goal is to balance those hormones. It's not just to throw hormones at ladies. It's to balance them. And when those hormones are balanced, those ladies are coming back and they're saying thank you. And if we back up just a moment,
Okay.
those ladies are coming into me right now saying they're in a transition period. They don't call it that, but they can look back 5 years ago and they can say, I had lots of energy, I had a lot of sex drive, I had endurance, but now things are changing. Things are really changing. I'm putting on weight. I can't sleep at night. I'm getting anxiety. I'm sitting in a room and suddenly I'm sweating. All of these things. I've got dryness. I've got all of these symptoms, and I'm confused. My cycles are out of whack. I need to get my life back. They're crying out for help.
Okay.
And for one reason or another, they're not always getting that help. And we can help.
Now, so you don't like synthetic hormones?
I don't take them, so it doesn't matter to me.
But you don't like them?
I don't like them.
Okay. Now, you're a pharmacy.
The thing is, when I say I don't like them, I have seen the side effects that those synthetic hormones have had on women. That's what I don't like.
Well, why do they take them then?
Well, because they're FDA approved. The pharmaceutical manufacturer has a great sales force. The doctors know that they're FDA approved. They're available. Most pharmacies carry them, and they write prescriptions for them. There may be other things involved with their decision to do that.
But you're saying that, I guess the main point is here, that bioidentical hormones will give the same results, and as you say, less side effects.
We've had a number of women who have switched from Premarin and Provera to natural bioidentical estrogen and natural bioidentical progesterone, and they're doing wonderful.